come back to South Africa now, where healthcare workers have been at the forefront in the fight against COVID-19 since last March. And I'm sure we all join me in thanking them for their incredible work over the last almost a year. But one organization has gone one step further. A Hospital Heroes movement has been launched to show appreciation for all the frontline workers and try and help lift their spirits. I'm joined by Kilona Radia, co-founder of the Hospital Heroes movement, to share some of the challenges faced by frontline workers during this time, and also how we can show our appreciation. And also, you'll see bottom of your screen the very well-known Dr. Imtiaz Suleiman, Gift of the Givers. He's the director there, and they've partnered with this movement. Dr. Imtiaz Suleiman, morning to you. I'll come to you in a moment. You and I talk quite often. We'll talk about your involvement. But first, Kilona Radia, congratulations to you. I mean, it's an incredible initiative. I think so many people have wanted to say thank you in some way or another, and you just seem to have gone and found that positioning, that way of doing this, the Hospital Heroes movement. Congratulations. Tell me a little bit about this in the little bit of time we have.
Great show, Gareth. Thanks very much for having us on the show. Really, the Hospital Heroes started from the fact that the second time around, the second wave has really intensified the pain and hurt that the frontline staff have been going through over the past year. They have been struggling to even go to the bathroom, let alone nourish themselves in that time. Sustaining this level for a period of almost a year now, it simply cannot be good for their physical health, let alone the emotional toil that they're going through. So this really was a little something to say, guys, it was New Year's Eve, Christmas. That's when the program really started as individual initiatives, and to say, we hear you, we see you, we care for you, and we care for your well-being too. It's a small little something, but it's a little something that you don't have to worry about. And it's that one little thing less for you to think about as you dedicate your life and your hours and your days and your energy towards looking after everybody else around you.
Kilona, I don't think many people can understand the sacrifices these frontline workers have endured the past year, but I think someone who does have a fair idea of this is someone who's really been at the forefront of just about every major effort, whether it be government, provincial or regional. It's Dr. Imtiaz Suleiman, Gift of the Givers. Dr. Suleiman, morning to you. From your organization, there's so many people who will try and be involved in some way, and you throwing your weight as Gift of the Givers behind Hospital Heroes movement really does speak to just how much of a difference this organization can make.
Good morning, Gareth. Yes, from the first day, on 15th of March, when the President announced the national disaster, our focus from that same day was, you've got to take care of the health workers. And you were seeing in Europe and America what was happening in world-class hospitals. The problem is you can have all the equipment in all the hospitals and all the oxygen, but if you don't have personnel, you're in a serious trouble. And the personnel were burning out. It had to happen in South Africa. We survived the first wave, but the second wave took them. If you look at the medical checks, and there's lots of medical checks in the country, and every day since November, end of November, it's just obituary after obituary. The amount of medical personnel that have passed on, 5, 6, 7 of them per day, every day in different parts of the country. That was adding to a huge stress of staff shortage, of working long hours, of watching people pass on in front of you, whether it's colleagues, whether it's family members, or whether it's patients, and you just look and there's nothing you can do. This has had a huge emotional and physical toll on the healthcare workers. And given the fact, it's long hours and no rest, and the anxiety, this disease, medical guys are not scared of conditions. They deal with any condition. But this disease has caused severe anxiety. And as I said, we're demotivated, we're depressed, we don't know what to do. So Hospital Heroes program comes in at the right time. It's not that if people can't afford the things that they're getting, they well can afford it. But the thought that somebody else is bringing this for you to understand and appreciate and be grateful for what you're doing, that thought and that action is priceless.
It really is, Dr. Suleiman. I think before I start running out of time with both of you, I think you've summed it up beautifully. It really is a precious way, and it's going to be greatly appreciated. Kilona, in the last minute or so that I have with you, is somebody watching us just have this brief conversation? Hospitals Heroes movement, how can we get involved? What can we do? Where can we find you?
We would love for you all to get involved. We would love for the nation to come in and say thank you. For those of you who have had ill people in the hospitals, adopt a hospital, take on the task, put a donation into giftofthegivers.org, make a difference. join the Facebook page, Instagram page. It's all on #Hospital Heroes. Join in, donate. Corporate companies can come together, bring their staff together, match staff donations. It's a 10 Rand. It's a small amount. It's as small or as big. Anything is going to make a difference. So thank you very much. We'd really encourage everybody to engage in this program and really rally around our staff, our healthcare workers, just to keep them going and to say thank you. And add a note to it. Sometimes it's just a little thank you note that really says everything.
I think so many people have wanted to try and do just that, but weren't sure how to do it. And now you've given them the outlet for that. Kilona Radia, thank you very much. Co-founder of Hospital Heroes Movement. #Hospital Heroes is where you can find their story. Also supporting this as well, Imtiaz Suleiman, Gift of the Givers, the director of Gift of the Givers, Imtiaz Suleiman. My congratulations and my thanks to both of you in joining us here on ENCA this morning to speak to us about that. #Hospital Heroes. We're back in a moment with you.